This announcement was made to the residents of Cane Grove in the east coast of Demerara during the official launching of the Caribbean Voice Suicide Gatekeeper 4-day activity in the community.
Agreed that we will amend the laws of Guyana to remove suicide as a crime. We will remove that totally from our laws. That is a decision that has already been made and announced, and we are in the process of doing the drafting the amendment to the laws. I expect that by the first quarter of 2022, that the laws of Guyana would be amended such that suicide is no longer a crime.
The announcement comes on the heels of decade-long cries by numerous stakeholders, including the Caribbean Voice, for the decriminalization of attempted suicide in Guyana. The existing law labels attempted suicide as a misdemeanor, and the guilty party is liable to 2 years imprisonment. But according to Dr. Ramsammy, while attempted suicide is traditionally treated as a crime, it is really a disease.
And the language of suicide, it has been one that we have struggled with. If we're going to address suicide effectively, we have to change the thinking and the language. And so we have to move away from this thing that people committed suicide. Something took their life, like diabetes kill people, cancer kill people. You never hear people say, I committed cancer, right? It's a disease. It kills you. And suicide is not different.
Mental health, which is the driving force of suicide, remains an issue of concern, Dr. Ramsammy said, while citing that more needs to be done.
Less than 1% of our health budget goes to mental health. But mental health contributes almost 20% to the global burden of disease. And we need to change that formula.
Meanwhile, in explaining the thrust of the Suicide Gatekeeper program, Caribbean Voice representative Dr. Margaret Hazelwood told Nightly News that the program will be expanded to other communities in Guyana. In the field of suicide prevention, the term gatekeeper refers to individuals in a community who have face-to-face contact with large numbers of community members as part of their usual routine. They may be trained to identify persons at risk of suicide and refer them to treatment or supporting services. As such, the program, which will be facilitated in collaboration with the Ministry of Health, is expected to benefit some 3,000 households in the Cane Grove area through the provision of educational sessions aimed at helping persons identify the warning signs of suicide and the preventative measures. It is Hazelwood's belief that the program will pave the way to a massive reduction in suicide rates locally. Blackbush Polder at Quarantine Berbice has been identified as the next community to benefit from the initiative. A 2014 report by the World Health Organization cited Guyana as one of the countries with the highest suicide rates in the world, 44.2 suicide rates per 100,000 deaths, 4 times the global average. In 2015, Guyana became one of only 28 countries to develop a suicide prevention plan in response to the report. The plan identifies factors that could contribute to the country's high rate of suicide. But despite the formulation of this plan, the country continues to record a high number of suicide deaths yearly. The Caribbean Voice, like many other non-governmental organizations under its mandate, has been providing mental health support to Guyanese for a number of years through workshops and other sensitization programs. For the HGP Nightly News, Kendell Richmond.